Welcome back, class. Let's continue the review of the content in your textbook on Chapter 38, Providing Wound Care and Treating Pressure Injuries. Lesson 38.2 is an overview of wound care. Upon completing the review of this presentation, as well as reading your chapter in its entirety, you'll be able to explain the major purpose of wound drain, identify the advantages of negative pressure wound therapy, as well as compare and contrast the therapeutic effects of heat and cold. The knowledge you're going to gain in reviewing this chapter, and then you apply it to the clinical practice setting, are as follows. You'll be able to perform wound care, including emptying a draining device and applying a sterile dressing. You'll be able to provide appropriate care for a pressure ulcer, perform wound irrigation, remove sutures or staples from a wound and apply thin adhesive strips, known as steri strips, and also give heat or cold treatment to a patient. There are several skill sets we will be covering in this chapter as well as in your lab, so please take time to familiarize yourself with these steps, and we'll go over them as well. There are various types of treatments of wounds. An example would be wound closures. Sutures and staples are used to close wounds. Surgical wounds can be held with sutures until the wound is healed. Additional treatments for wound closures include the use of silver wire clips, large retention sutures, steri strips, or even dermabond. Treatment recommendations for open wounds are based on the wound's classification, which is the wound's color rather than the wound's dimensions. The three types of classifications are red, yellow, and black. So for the red wounds, these wounds are clean and ready to heal. Therefore, the recommended and best method of treatment will be to protect the wound. Now, for the yellow wounds, these wounds have a layer of yellow fibrous debris or exudate. The wounds can be yellow if there's a large amount of leukocytes present. There may be sloughing as well. For these type of wounds, the recommended treatment would be to frequently cleanse the wound, and there should be a dressing applied that will absorb the drainage and debris. For black wounds, these type of wounds need debridement. Debridement is referred to as the removal of all foreign or unhealthy tissue from a wound. The removal of these tissues will allow for proliferation and healing to begin. Drains and drainage devices. At surgery, one or more drainage may be placed to a wound. Drainages provide an exit for blood and fluids that accumulate during the inflammatory process. It may be active or passive. An example would be your Penrose drain, which is a flat rubber tube. Plastic drainage tubes can be connected to a closed drainage system. An example of this would be your Hemovac or your Jackson Pratt. Figure 38.6 can be found in your textbook on page 767. This is an example of a Penrose drain. This is an example of a Hemovac drain system. This can also be found in your textbook on page 767. And here you have the Jackson Pratt type of drain. Let's discuss the various types of dressing. And I'm sure you all are eager to learn about the dressing types and eager to start doing dressing care for patients. Many nurses do like dressing care and providing dressing care, and so now we have the opportunity to go over the various types of dressings. So dressings, which are protective covering placed over the wounds, serve many purposes. They prevent the entry of microorganisms, and they also prevent microorganisms from escaping the wound. In addition to that, dressings can also absorb drainage. Dressings can be applied for applying pressures to control bleeding for a wound, and also used for improving the adherence of a skin graft to the graft site. It supports and stabilizes tissue and also can reduce discomfort associated with wounds. There are a variety of types of dressing and materials available. You have your dry sterile gauze, telfa or other non-adherent dressings, surgical pads or also referred to as abdominal pads, your foam dressings, transparent film dressings, and your hydrocolloid dressings. In your textbook, on page 769, you can find this figure 38.9. These are various types of dressings available. In treating a wound, ensure that you cleanse the wound with warm isotonic saline. Grossly contaminated wounds are cleansed at each dressing change. Sometimes there's antibiotic solutions ordered for wound irrigation. Surgical wounds and open wound dressings require sterile techniques. And also, some wounds may require hydrocolloid or wet to dry dressing care. Let's discuss debridement a little further. We've heard this terminology before, so hopefully this doesn't come to you as a surprise, but debridement is actually the removal of necrotic tissues from a wound that is not healing. Sharps can be used to debride wounds, such as scissors and forceps, but also substances like a topical solution or enzymatic debridement solution can be applied to the wound bed itself, and what this does is liquefies the dead tissue so that it can be removed. These substances are placed in the wound, and then another dressing is applied over it and holds it in place. This is useful for unaffected wounds. Mechanical debridement uses wet to dry dressings or whirlpool treatments. Securing dressings. So dressings may be secured in a variety of ways. You can use your stretch gauze, mesh netting, elastic bandage, Montgomery straps, binders, and as well as tapes. In your textbook on page 770, you can find this figure 38.10. This is an example of the use of Montgomery straps. 38-11 is an example of tape across a joint or crease. And here's an example of an abdominal binder. Some providers may prescribe negative pressure wound therapy for wounds that are difficult to heal or not responding to therapy. These wound treatment devices are also referred to as vacuum assistive closure or VACs or wound VACs. The negative pressure therapy involves the application of a suction device to a specific wound dressing to institute negative pressure at that wound site. What this does then, it draws the edges close together. The negative pressure and suction removes fluid from the wound, allowing increased blood flow and therapy oxygen and nutrients to be delivered to the wound site. So what happens is, with this process, the wound will heal from the inside out and over time. This is an example of a wound vac. So how are vascular ulcers treated? You want to cleanse the ulcer at each dressing change and use only normal saline. Then cover the ulcer with a dressing. Stage 1, you want to apply thin film dressings to protect the ulcer from shearing. A stage 2, non-infected vascular ulcer, you can use a hydrochloric dressing. Stage 3, an ulcer that is draining, will require an absorbent dressing. Infected ulcers can be treated with non-inclusive dressings. Oxygen chamber treatment is used to treat non-healing wounds occasionally. And also, electrical stimulation may be used to accelerate wound healing. In your textbook on page 772, you can find this example of wound irrigation. So we've did an overview of different types of wound care, wound types. Let's talk about common diagnoses that you would apply for your patients with wounds. So here are some examples of nursing diagnosis. You have your impaired skin integrity related to surgical incision or trauma. Depends on obviously how the incision or the injury occurred. You have risk for infection, acute pain, activity intolerance, disturbance of body image, knowledge deficit, and then anxiety related to the need for performance of wound care. Suture and staple removals. Although this is often performed by a physician, sometimes they do ask nurses to do this, and sometimes nurses are trained to remove sutures. Sutures are cut and pulled through the skin. You must follow sterile technique while removing sutures. In staple removals, this requires special instruments to remove the staple from the skin. Steri strips are then applied after the removal of the sutures or staples. And then parts of the sutures left under the skin may cause inflammation. So when you're performing this technique, make sure that there isn't any suture parts left over. This figure 38-16 can be found in your textbook on page 782. This figure can also be found in your textbook on 782. It's a special technique that is used to implement the removal of staples. So as you see here, there's a special device used to remove staples. This figure 38-18 can be found in your textbook on page 782. This is an example of applying steri strips to support the incision after the removal of sutures or staples. Just consider the reasons why you would apply steri strips after you remove sutures. Eye, ear, and vaginal irrigations. In irrigating eyes, this may be performed when an injury is involved and debris or causative substances is present in the eye. Ear irrigation is used to remove wax or foreign substances. Vaginal irrigation may be ordered for infections or surgical preparation. Hot and cold applications are usually prescribed by a physician. These type of treatments can be dry or moist. Heat is applied to the skin to provide general comfort and speeds up the healing process. It may be used to release pain, reduce congestion, relieve muscle spasms, reduce inflammation and swelling, as well as provide comfort and elevate body temperature. See table 30-2, page 785 in your textbook. This figure is an example of aquathermia therapy. So why do we use cold application or cold therapy? There are two major purposes for using this type of treatment. It helps to decrease swelling and it helps to decrease pain. So it also decreases circular activities leading to a numbing feeling. It's used in the form of compresses, ice bags, collars, or even hypothermia blankets. Let's review some goals that you would identify for your patients who have wounds. So you can say that your expected goal or outcome for your patient would be that the wound edges will be well approximated, the wound is clean and dry from redness or swelling, the patient states that the pain is gone, patient states that energy has returned by evidence that the individual can walk in the hall, or the patient returned demonstration of dressing change and it was performed properly. So when you're devising your plan of care, your nursing diagnosis, these are some diagnoses that you can set up for your patient. And at the end of your nursing process, remember that you're evaluating the outcomes of these goals. So look at your patient's progress, assess your patients, and evaluate the patient's progress to see if these goals are being met. And if not, certainly revisit the goals and see if you need to kind of adjust your plan of care and your nursing interventions so that way that the individual is progressing towards their goals and expected outcomes. Okay, class, we are approaching the question section of our presentation. Please remember to post a response. And let's get started. So Kara's patient is going home with sutures. When are sutures usually removed? Is it A, 3 to 5 days, B, 5 to 7 days, C, 7 to 10 days, or is it D, 14 days? Sutures are usually removed 7 to 10 days, so the correct response here is C. Just remember that sutures may remain in longer for elderly patients. Eric is about to change a dressing on his patient. Which of the following is true regarding dressing changes? Is it A, dressing changes may be performed as needed without a physician's order? Is it B, irrigations may be done as needed without a physician's order? Is it C, clean gloves and forceps are used for fresh, sterile wounds that are touched? Or is it D, wounds should be cleansed with warm water? Let's take a moment to answer this question. Which one is true? The correct one here is D. Wounds should be cleansed with warm water because cold solution slows the healing process. Dressing changes and irrigations require a physician's orders no matter what. Sterile gloves or forceps are used whenever an open or fresh surgical site is touched. Final question. Eric's patient has an order for cold compress therapy. How long can cold compress therapy be applied? Is it 10 minutes, 20 minutes, 30 minutes, or 45 minutes? Take a moment to post a reply. The correct response is B. Cold compress therapy is applied for a maximum of 20 minutes at a time. Cold compress therapy is applied in the form of compresses, packs, ice bags, or even hypothermia blankets. Please do not exceed 20 minutes when applying such therapies to your patient. This concludes my presentation on providing wound care and treating pressure injuries. Again, this content covers the information in your textbook on Chapter 38. Please ensure that you read the text chapter in its entirety. Thank you.